Hi Jake, thank you so much for joining us today to tell us about the charity that you set up following your own personal mental health struggles, that thankfully not only did you come through with the love and support of your now wife, but you have gone on to use that experience to make a remarkable and positive difference to so many other lives. Can you tell us a little bit more about your journey to creating the charity, Chasing the Stigma, and what the Hub of Hope is all about?
Yeah, of course. I mean, first and foremost, it's not something that I ever thought I would do. You know, I was just a very normal, ordinary lad, really. Nothing really remarkable. I never had any experiences of mental health, good or bad or indifferent, or certainly didn't know that I'd had any experience of mental health, good, bad or indifferent. Knew nothing about it. You know, it was not something that we were ever taught in school. And so when I started to struggle with my mental health, I didn't know that I was struggling with my mental health. I just thought I was just, I don't know, struggling with life or being an adult. And that kind of misunderstanding was kind of what was the downfall in many ways, because it was I didn't feel like it was something I could ask for help for, because I didn't know that there was something there. And so, you know, for me, I kind of just lived a life feeling the way that I did, but trying to just fix it myself, you know, in probably unhelpful ways. And obviously that led to me reaching a really, really low point and actually making an attempt on my life 10 years ago. And coming through that, I mean, you know, like long story short, but kind of coming through that with the, as you said, the help and support of my family, my now wife, who's my girlfriend at the time. I decided to speak out about what I'd gone through, and I'll be completely honest, it wasn't to help anybody, it was to help myself. It was to almost try and reclaim my journey, if you will, and to own it. But what happened as a result of me speaking about what I'd gone through was that people started coming to me and saying, you know, I felt this way, or I'm currently feeling that way, and people were coming to me in distress, and I was suddenly getting asked by so many different people about, you know, what should I do to help myself, to help my partner, to help my son or my daughter. And I had no idea. I had absolutely no idea. And quickly, my story got picked up in the press. It got picked up in local press to begin with, and then in national press. And I was being asked to go on television and radio to talk about what I'd gone through, and people were saying, you know, it'll help people. And I was never prepared for that. I was never prepared to know what to do. But every single time I gave an interview, people came to me asking me for help. And that was people I knew, but people I didn't know, people from all over the country, from different parts of the world were coming to me. And there was absolutely nothing special or unique about me and my story and what I was saying. I was just somebody saying I've not been well. But it was enough for people to reach out, because I believe anyway, people were seeing somebody who they could relate to, somebody who would believe them, somebody who wouldn't judge them. And what they thought was somebody who has been there and come through the other side. And it was then that I realised that power of lived experience and how important that was to try and break down those barriers and offer that hope to other people. But I knew that I didn't just want to just go on telly, talk about what I'd been through, and then that's it, and then just have to deal with these emails. So I wanted to do something different about it. I wanted to take it away from it just being me and do something practical. So I created a charity, which is a national mental health charity called Chasing the Stigma. And what we want to do as a charity is to just be ordinary people, not use jargon, not use clinical language, and try and really engage everybody in a conversation about mental health, because we all have mental health. As I said, mental health is not a bad thing. We can all struggle with our mental health, but at the same time, we can all have really, really good, positive mental health. And one of the things that I wanted to be able to do was to make it easier to find that help and support. So when people come to me saying, what do I do? How do I get help? I was like, I've got no idea. Don't know. I wasn't somebody who went and got that help. So I don't know how I'm going to help other people. And I started to look into it and learn a lot about it. And you know, we might touch on numbers and statistics, particularly around suicide. But you know, suicide biggest killer of men under the age of 45, biggest killer of all people under the age of 34 in this country. But of all the people who die by suicide every year, almost 3/4 of those people are not known to mental health services or haven't been seen within a year previous to death. So it's quite clearly a problem between somebody feeling unwell and somebody accessing help and support. So what I wanted to do was just to create the easiest possible way to find that help and support. And we've all got apps on our phone to find the nearest takeaway. You can travel somewhere in this country, never been there before, but if you want a kebab or a pizza, you know how to find it. Why can't we have that same thing for mental health services? So we created a website. It started as a list just on a spreadsheet in my room in my mum's house. And then we built into a website and then into an app called the Hub of Hope. And what that app will do is it will use your location to pinpoint the nearest local support to you, as well as national support as well. And that's now the biggest and most comprehensive mental health signposting tool of its kind in the UK, used by NHS UK, used by Samaritan's Mind, or every organisation you can think of. And it's not rocket science. If it was, it wouldn't be me who would do it, but it's just trying to find the easiest way for somebody to be feeling unwell and then find the local support to them wherever they are.
Oh no, that's great. Thank you, Jake. What I loved about the website was the number of personal stories of hope that were on there, and the amount of fantastic work and great things that have come from people that are going through these darkest of times and challenges, where people have been feeling that they're not worthy to even exist. Sort of the amazing things that they've come through after going through that, and the thriving and by sharing their experience and advice. And as a result, helping so many other people in the meantime. And obviously, I do think the work you're doing is amazing. And I was going to ask you one of the questions that I think you ask a lot of the people that you speak to is, which is today, if you could speak to yourself at your lowest point, what would you tell yourself?
That you deserve to get better. I think there's so many people who, for whatever reason, feel like asking for help is not only a hard thing, but it's something that they don't deserve to do. And whether you are feeling unwell physically or mentally, you deserve a chance to get better, and that we should all give ourselves a chance to get better. I think there's a lot of differences between physical and mental health when it comes to how we approach it and how we approach feeling better. And if the most simple way of putting this into context is that if you were physically feeling unwell, you would give yourself a chance to get better, because you think, I don't want to feel like this. You'd go to a doctor, you'd speak to somebody, you'd take medication, you wouldn't worry about that, you'd take it. If it didn't work, you'd go back. You'd go back and say, that's not working, or I'm getting bad side effects or whatever. You constantly give yourself a chance to feel better. And it should be exactly the same with your mental health, is that you should find what is right for you. If something doesn't work, you try something else. But we all should know that we deserve a chance to be happy, to be healthy. And if we're not feeling that way, then we should be reaching out and giving ourselves the best possible chance to feel better.
Thank you, that was great. So you've also developed the Ambassador of Hope mental health training programme, and that supports organisations equipping all members of staff with that really important knowledge to talk about mental health confidently within the workplace especially. Can you tell us a bit more about that and why you believe it's so important to talk about mental health openly in the workplace?
Yeah, the very, very basic element of mental health, if we take it right down to the basics, is that everybody has it. So just like we all have physical health, our mental health can be good, it can be bad, it can be indifferent. It doesn't matter who you are, where you are, what you do. Everybody can have good and bad mental health, but we're not equipped to necessarily know and understand what to do if we or somebody else is feeling unwell. What we've done with the Ambassador Hope training program is we've written that ourselves, first of all. So that was written from a lived experience point of view. And we're trying to really take it back to basics. So what we're not going to do through our training program is make people experts, because unless you're going to university and you're studying to be a practitioner or anything, you're not an expert. so you don't have to pretend to be. But we want to offer a baseline level of understanding to everybody. And again, in a lot of workplaces, mental health training is kind of, you know, it's for a handful of people. So, you know, I was seeing organisations that would have, for argument's sake, 700 members of staff, but would have 50 people trained in mental health training. So I think, well, there's 650 people there who have all got mental health, but have got no training or no understanding at all. So how can we get to 650? So that's where our training is short, it's cheaper, it's written in a way that's not going to be intense or, you know, use jargon and clinical language. We've written it from a lived experience point of view as ordinary people, and it's delivered from a lived experience point of view as well. So all of our trainers who work directly for us, so we always make sure that we maintain the quality of the delivery as well, but they all have their lived experience as well. We know if you're going to a mental health training session, people are going to be rolling their eyes, people are going to be, oh, this is going to be horrible, this is going to be intense, I thought it's going to be awkward, I don't want to do it. So we try to address that, we try to really get rid of that and bring it right down to basics, and do it in a way where it's short enough, cheap enough, and good enough to be able to equip everybody in an organisation. And that way we can create an environment of understanding so that everybody has some level of understanding, and it's a lot easier then to create that nice natural environment to have those conversations. You know, as was mentioned just before, you know, sharing stories, sharing experiences, talking about it is one of the biggest barriers. And as soon as you can create a culture that it's easier to do that, people will absolutely want to do it and will benefit from it as well.
Great, thank you. And you probably touched on some of the points already, but for all the employers out there, and with your experience of working with many different organisations, can you share with us some of your sort of best tips that would support them to support their team's mental health and wellbeing?
One of the best things I think any workplace can do is to try and have a whole workplace approach to mental health, not just talking about mental health as a negative, talking about mental health as a positive, as an aspiration. Again, looking at how we sometimes maybe look at physical health. You know, you'll have organisations who will talk about eating well, drinking well, exercise and looking after yourself, all these things to have good physical health. But it's exactly the same with your mental health. So mental health shouldn't just be a poster of somebody holding a head and looking sad. It should be an aspiration, creating an environment that is healthy and mentally healthy environment for your employees is absolutely crucial. And by doing it and talking about it in a positive way, that's going to make it a lot easier to talk about it if somebody's mental health is struggling. And I think it has to be part of the everyday. So you can't just wait until weeks like Mental Health Awareness Week or Mental Health Day in October. It's actually making it part of the every single day. So that Monday you come in after World Mental Health Week, are you still talking about it then? Because that's when you should be talking about it. Have it part of that every day, whether there's stuff on emails, whether it's stuff on notice board, but it's constant. And it's not just talk either. It's listening to people. It's understanding what will make their jobs, their lives, their everydays better from a mental health perspective, putting things into place, and not just trying just to tick boxes and put things in place and say that's all we do. It's looking at new ways, challenging how you maybe think it works, and listening to your colleagues and your employees to understand what people need. And then to working with other people, whether that's people like ourselves or a lot of other mental health providers and training providers and others out there, to be able to say, yes, we might have internal solutions and support, but understand that not everybody will want to go through those. So offering something else as well, particularly external, can be really big in allowing people to understand they can reach out externally if they need to, and in turn maybe will come internally as well.
That's great, thank you.
Yeah, thank you for that. We had a look at some of the research that you'd done with Chasing the Stigma, and you conducted it, I believe, alongside one of our clients, Network Rail, and found that nearly half of the Brits agreed that their mental health has understandably taken a hit since the pandemic, so including symptoms such as anxiety and loneliness and depression, which has surged in almost all age groups. So it is quite clear that we are facing a mental health crisis, and as part of tackling this crisis, you've actually joined a brand new multi-agency task force to address the impact of COVID-19 on the nation's mental health and well-being. Could you tell us a little bit more about that?
Yeah, so this was something that was created quite early on in the pandemic, because I think it was really quickly apparent that we were going to have to address our mental health. And I think maybe initially we were all expecting lockdowns and the isolation to be the key kind of reason why people's mental health struggled, and actually it turned out that it wasn't. It was actually, now as we're coming out of these, we've lived a life where we've almost been shielded, where we've been told to isolate, we've been told to stay away from people, we've been told not to go into work and to mix and go on public transport. And it's actually coming out of that, where people are now having to completely readjust to normal life. A lot of people, don't get me wrong, a lot of people during those periods of isolation and lockdowns really did struggle, and not being able to access services, etc., as they usually would, had a massive effect. But at the same time, a lot of people are almost in a safety bubble as well, and coming out of that has been really difficult. One of the things that we've noticed through the work with Network Rail has been how apprehensive and anxious, nervous people are getting back on a train, going back into that commute, being around people again. So again, this task force was about that initial thinking, the impact would be immediate, but the impact is we're seeing that now. And with the Hub of Hope, we've seen huge dramatic increases. Every time Prime Minister made a press conference, we've seen spikes in people looking for help and support. And then initially that was around lockdown announcements, but then we started seeing it when he started talking about lifting lockdowns and restrictions, and people having to come back out. We had a 238% increase of users looking for help and support as restrictions were reduced. So it just shows you that actually right now where we are, there's a whole new level of attention needed on mental health. And why working with Network Rail has been so important is because we're able to get that message to people as they're going about their daily commutes, and that's what's really, really important. And we're actually just launching a campaign as part of Mental Health Awareness Week, but going throughout the month of May with Network Rail, called Brighter Journeys, which is about trying to make railway stations a little bit nicer, a little bit brighter, and having a conversation around mental health, but around positive images, positive smells, positive sounds, bird sounds and flowers and aromatherapy in stations, to let people know that you can stop, you can take a second, you can talk about your mental health, and you can find help and support if you need it.
That's brilliant, thank you.
Yeah, I love that. I never really thought about, obviously knew there was a crisis from all the lockdowns and people, like the loneliness and all that kind of thing, and never really kind of thought about it still being, thought the crisis sort of now would be sort of like the after spill of what's happened, rather than people going through what they're having to adjust to going back to the new normal. And then just before we finish, what would your advice be to somebody who's struggling with their mental health right now? What would you say to them?
One thing I would say is that no matter what you're feeling, no matter how impossible it might seem, no matter how dark the thoughts might be, no matter anything like that, you're not the only one to have thought those things, to feel the way that you feel. Like, I can absolutely guarantee that other people have felt the same, and other people have come through. No matter what, there's always a way through. But to go back to what I said about earlier, you've got to give yourself a chance. Give yourself a chance to get better, because we all deserve a chance to get better. Where I was, I didn't ever imagine that I could ever live a life. I didn't think I deserved to live a life. I didn't think that it would be possible to live a life. I thought I'd hurt too many people, I'd said too many things, I'd lied too much, all these different things. But now that girlfriend who saved me at the time is my wife, and we've got 2 kids. Never in a million years would I have imagined that. So even if you can't see that light at the tunnel, at the end of the tunnel, even if you can't imagine it, just know and believe that it is there. Just believe that it is there, and that's enough to give yourself a chance to get better, and that you can get better. And there's always help, and there's always hope.
That's perfect, Jake. That's all our questions. Thank you so much for taking the time to meet with us today. Yeah, really interesting information there. It's great. Thank you.
Yeah, really inspirational story as well that you've shared with us and everything you've done. So yeah, thank you so much.
Oh, my pleasure.